Hi, my name is Melvin Ocaña, and I'm going talking about vitamin D supplementations during pregnancy and the prevention of childhood asthma. Definition: asthma is a chronic or long-term condition that intermittently inflames and narrows the airways in the lungs. The inflammation makes the airways swell. Asthma causes periods of wheezing, chest tightness, shortness of breath, and coughing.
Asthma is a lung disease that inflames and narrows your airways. Normally, as you inhale, air moves freely through your trachea or windpipe, then through large tubes called bronchi, smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your bronchioles expand when the air is warm, moist, and free of irritants and allergy-causing substances called allergens. When air is cold or dry or contains irritants or allergens, your bronchioles contract. If you have asthma, your airways are frequently inflamed and swollen. Certain substances can cause your inflamed airways to overreact even more, resulting in an asthma attack. Triggers of asthma attacks are slightly different for everyone, but usually include outdoor irritants and allergens, such as pollen, smoke, pollution, and cold weather; indoor irritants and allergens, such as mold, pet dander, dust mites, and cockroach droppings; food allergens, such as fish, shellfish, eggs, peanuts, and soy; and conditions such as respiratory infections, stress, strong emotions, and exercise. The symptoms of an asthma attack include coughing, wheezing, shortness of breath, and tightness in your chest. During an asthma attack, also known as a bronchospasm, the muscles around your airways tighten, and the airway wall becomes more swollen. Your airways also produce thick mucus that narrows them even more, making it hard for you to breathe. If you have asthma, your doctor may prescribe medications to reduce inflammation in your airways, constriction of the muscles surrounding your airways, or mucus secretion in your airways. During an asthma attack, you may need to use a short-acting rescue medication called a bronchodilator. This medication causes your airway muscles to relax quickly and provides symptom relief within minutes. Since there is no cure for asthma, the goal is to prevent you from having asthma attacks by using long-acting anti-inflammatory control medications. If you take them every day, they will reduce the inflammation of your airways, making them less sensitive to triggers of asthma attacks.
Applications in medicine. Vitamin D supplementations may be effective in preventing the transient forms of wheezing that occur in prescholars but not allergy-related asthma, the prevalent form of persistent disease during the school years. Unlike school-age asthma, transient wheezing is unrelated to allergies and the most common cause of wheezing, regardless of prognosis, in this age group are viral lower respiratory tract illness. A previous report showed significant effects of vitamin D supplementations on the developing immune system, and it is plausible to surmise that during the first 3 years of life, vitamin D supplementations may decrease susceptibility to viral infection, as has been shown in a recent clinical trial involving older children.
Organic or not, milk is an important source of vitamin D, of course, and it could help people suffering from asthma.
CBS News' Dr. Max Gomez here to explain that. Dr. Max?
That's right, Christina Maurice. You know, when asthma is well controlled, it can be reduced to an occasional breathing issue. Asthma becomes serious, though, even life-threatening during an attack, when the airways spasm and shut down. That's what doctors want to prevent. Turns out vitamin D may help do the trick.
Tightness in your chest, you'd be having a hard time breathing, a lot of coughing, you feel like your airways are really tightening, you're like turning red.
Chris Udavan is describing the sensation of an asthma attack. His lung problem is pretty well controlled these days, but there's one more thing he could be doing to prevent another attack.
We've known over the last few years from many studies now that a low vitamin D level may portend negative impact on lung function in those with asthma.
That's right, vitamin D, sometimes called the sunshine vitamin because your skin makes it when exposed to sunlight, and which is essential for calcium absorption and strong bones, also seems to have an anti-inflammatory property. And inflammation is the key characteristic of asthmatic airways. Now, an Israeli study in the European Journal of Allergy and Clinical Immunology finds that vitamin D is very important for asthmatics.
In this study, the low vitamin D levels were correlated with a greater incidence of asthma and poorly controlled asthma.
In fact, patients with the lowest vitamin D levels had more frequent and more serious asthma attacks. Udavan told me he knows his vitamin D level is low.
Every time I would go to my yearly physical, I would have lower levels of vitamin D.
The solution is more time in the sun, hard to do in a New York winter and risks skin cancer. Drink more cow's milk, but you need a lot if you're really deficient, or just take vitamin D supplements.
A good amount of vitamin D would help my asthma. That, of course, I would be doing something to kind of treat that.
Now, even though most people in the northern hemisphere are low in vitamin D, we just don't get enough sunshine, and you have to take massive doses of vitamin D before it becomes toxic. It's still a good idea to have a blood test to find out your actual level before taking supplements. Christine?
All right, Dr. Max, thank you for that information.
Pros and cons. Pros. Vitamin D supplementations provide protections against wheezing illness. This protection is strongest in the first years of life and tend to wane between the age of 1 and 3 years. Vitamin D supplementations may decrease susceptibility to viral infection. And cons. Not effective is preventing school-age asthma.
So we are interested in looking at vitamin D levels in kids with asthma and allergies, as well as potentially looking at mechanisms for vitamin D's effects on the immune system. The clinical data that we obtained showed a couple different conclusions. One is we saw that low vitamin D levels were very common in kids referred to National Jewish. The second part of our clinical data looked at features of asthma and its relationship to vitamin D. And what we found is kids with lower vitamin D levels tended to have lower levels of lung function, as well as several increased measures of allergy, such as the amount of IgE antibody in their blood and the number of positive skin tests that they had. We also found, in terms of the medications that we were
had lower vitamin D levels. In the lab, when we took immune cells
potential to have what we call a steroid-sparing effect. Whether it does or not is really unknown at this point. The next step in investigation really needs to see if vitamin D supplementation leads to lower levels of medicine use, better lung function, and better asthma control.
Issues appliced in Ecuador. Vitamin D deficiency and insufficiency has been associated with asthma Ecuadorian children. A cross-sectional studies of 3,003 infants in Ecuador showed that risk factors for recurrent wheeze include daycare attendance, a cold in the first trimester of life, daycare attendance, and maternal smoking during pregnancy.
I'm going to say a couple things about vitamin D supplementations. Okay, so the first trial I looked at was there were 24 trials of over 5,000 participants who took vitamin D supplement about 2,000 units per day, and they saw a 30% reduction in small for gestational age size babies. You know, you can take a vitamin D supplement and reduce your risk of your baby being abnormally small for gestational age. And 2,000 units a day is sort of a standard dose, so I don't think there's anything unusual about that. And then the other study to tell you about was about 1,200 women who took vitamin D pre-conception, and they looked at the vitamin D levels in these women, and they saw the outcomes and compared them for people who had adequate levels of vitamin D versus inadequate levels of vitamin D. And what they found was in the group of women who had appropriate levels of vitamin D, they had decreased risks of miscarriage, increased probability of actually getting pregnant and having a live birth. So, you know, here's another example of sort of a normal dose of vitamin D improving outcomes in pregnancy. So I do think that evidence is mounting for people to take vitamin D supplementation preconception as well as while you're pregnant. And it does appear that it's going to help improve outcomes. So I do think that's a good idea. I say I recommend it.
Conclusion. Although supplementation was not effective in preventing school-age asthma, vitamin D supplementations during pregnancy may still play a role in averting less persistent forms of wheezing in infants with a parental history of asthma and allergies. In spite of its good prognosis, transient wheezing can be associated with severe asthma, especially during the virus season.